We're going to go through and just kind of introduce the NACC team, the ECHO team. Lindsay, you want to go first?
Sure. I'm Lindsay King-Cooney. I'm the Community and Tribal Engagement Specialist at NACC.
I'm Nikki Jardina. I'm the Infectious Disease Nurse at NACC.
And my name is Tina. I'm the Harm Reduction Program Supervisor here at NACC.
And I'm Michelle Corcoran. I'm the Nurse Manager for the MAT program here. Dr. Robbie is not able to join us today. That's why you guys are hearing from me instead. Renee, did you already introduce yourself?
I'm the Elder in Residence at the clinic. I'm Renee Bolio-Banks. It's nice to meet you.
I want to introduce everyone to Danica. Danica, as our speaker today, would you mind introducing yourself?
Yeah, good morning, everyone. Halito Atishok Shalubo Hilili Fijik. I'm Danica, and I'm a citizen of the Choctaw Nation of Oklahoma, and I'm the Behavioral Health Programs Director at the Northwest Portland Area Indian Health Board, and I'm glad to be here.
Thank you. And we'll pull up some slides here. Okay, so this is the Midwest Tribal ECHO, as you all probably know. And today we're going to be talking about trickster spirits and the opioid response. So I think we're all looking forward to this. So a little bit about NACC, if you're not familiar with us. We were established in 2003. We're a federally qualified health center, or an FQHC. We're in South Minneapolis, the urban Indigenous community. It's right on Franklin Avenue in Minneapolis. So we have a whole host of programs, and if you want to learn more, you can certainly go to our website at nacc-healthcare.org.
And then some session guidelines for today. So please note protected health information. We'd ask if you could mute yourself if you're not speaking. You're always welcome to eat your lunch during this time. If you could please let us know who you are in the chat. So name, title, organization, and email, we would really appreciate it. And we also invite you to use the chat if you have any questions or comments during the presentation. Some announcements. So our next ECHO is February 1st, and that's going to be with Melanie Nadeau. And she's going to be talking about centering culture in the treatment of opioid use disorder with American Indian and Alaskan Native communities. And then February 15th, we'll be hearing from Mindy Bird on the Mending Broken Hearts program. This is just a list of a few other ECHOs that we recommend that cover topics such as OUD and MOUD treatment. So if you want any more information, feel free to let me know. And then continuing education, we do offer CE credits to those who are eligible. We just ask that you fill out the survey. I'll put the survey link in the chat today, and then I'll also send out an email later. And then finally, case presentations. We always encourage and welcome if you have difficult cases or success stories to share. They make for great discussion and learning from each other. So just let me know if you have one to share. And then with that, I will hand it over to our speaker for today, Danica. Welcome.
Hello. Oh, great. Thank you. And thank you for sharing my slides for me. Yeah, today I wanted to talk a little bit about the way that we have been kind of incorporating traditional Indigenous knowledge into some of the work that we do, and particularly we talk about the opioid epidemic as a trickster spirit. So I want to share a little bit about what that looks like. Next slide. So for today, I want to talk about our strategic agenda that was created 4 years ago, and we are actually in the process of adapting that to address the impacts of COVID and fentanyl. I'll talk about our trickster stories and the connection between trauma and substance misuse, and an overview of historical and ancestral wisdom. And then we'll talk a little bit about some skills to address trauma and the view of Indigenous wellness and healing. which is a lot to cover in about 30 minutes, but I'm going to get through it. Next slide. So 4 years ago, we developed a tribal opioids response strategic agenda, and we went to a lot of different communities nationally to talk about the opioid epidemic in their communities. And there were 7 primary points that came out of that. But we interviewed policymakers, people who do chemical dependency treatment, peer recovery people, and we also interviewed people who, Native people who were injecting drugs, and developed the agenda based on those conversations. Next slide. And there were 7 points that came out of it, and I won't go into all of those points. And if you would like a copy of that agenda, you could just email me and I'll send you a copy of it, or I can send it to the organizers and you can have a copy. Also a copy of our Trickster story that we published. But the primary thing that came out of these conversations was, this idea that culture is medicine, and that we need to be centering our culture and our cultural knowledge as a protective factor, and really understanding what that means. It's that old adage, nothing about us without us. And so we took that very seriously, and we're developing, incorporating traditional Indigenous knowledge into all of the work that we do at the Northwest Portland Area Indian Health Board. We're developing a program called Every Day a Ceremony, which is an intervention, health promotion intervention for young adults or late adolescents. We developed the Trickster story. And we also have Elders and Knowledge Keepers Echo with Elders and Knowledge Keepers from the Pacific Northwest, who also provide clinical support to our tribal partners, and specifically behavioral health aid students. Next slide, and I'll put a link to that Echo in the chat when I get a minute. But when we talk about tricksters, this presentation really is an attempt for us to understand why Native people, tribal people haven't responded or reacted to Western models of treatment. And so, for tribal people, we all know that current and past political and social events help shape the context of our lives in ways that other Americans don't experience. And the study of trauma, whether it be historical or present, is connected to, historical genocide, assimilation, oppression, and disparate treatment that impacts the health and wellness of tribal people. And a culturally responsive mental health system must recognize the broader socio and political factors that underlie mental health issues for a lot of different communities, primarily Black and Indigenous communities. And there's a lot of data that show that there's a connection between historical trauma and current trauma to substance misuse. And even the American Psychological Association guidelines recognize the importance of providers understanding socio-political factors in a client's treatment, such as the generational history, the history of migration, citizen status, English fluency, and the extent of support from family and community, and the level of stress resulting from acculturation. And that a successful mental health system must find ways to integrate mainstream services into culturally traditional services to address mental health needs of communities of color. So what we kind of talk about within this context is that we're, as tribal peoples and people working in tribal communities, we have to navigate both the Western world and the Indigenous world and navigate these spaces in between. Next slide. And so, we know that substance use disorders can impact anyone because it's a chronic health condition and not a moral failing. And as a community, we can look towards the story of the trickster or the tricky one to learn how substance use disorders can impact Native communities in similarly sneaky and cunning ways. In many tribal communities, there are oral traditions around the trickster. And, you know, in the Pacific Northwest, we have raven. In some communities, it's a coyote. I'm Choctaw. One of ours is, is shawi, which is a raccoon or a rabbit. And so a lot of tribes have these stories of the trickster. But generally speaking, the trickster scandalizes, it disgusts, amuses, it disrupts, it chastises people. Yet the trickster is also a creative force for transforming their world, sometimes in bizarre or outrageous ways. And when you think about like a coyote with its instinctive energies and cunning, eternally scavenging for food, he represents really the most basic instincts of the human condition. And in some other narratives, he's also the father of Native people and a strong conductor of spiritual forces in the form of sacred dreams. And so in respect to substance use disorders, the substances we use are first medicines meant to cure and heal. And at some point, this transforms into misuse of the medicine and then moves into dependency. So when you think about, Eduardo Duran, he talked a lot about how these conditions that impact our lives, like substance misuse, but specifically the drugs themselves have a very specific spirit, and that the spirit can either be used for good or for bad. And when you think about opioids in particular, they're really important medicines that we can benefit from. For me, I've had a lot of oral surgery, and I'm really grateful for opioids. But at some point, that spirit can get twisted and turn into something different. So we can imagine that there's a trickster spirit that is a culprit in this, that a spirit that is attempting to teach us important lessons about our humility, compassion, about living in balance with the natural world, respect for the spirit and the medicines that we use. And, when we're talking about medicines, we're really not talking about from the Western context of a prescription, but rather the energy or the spirit that those traditional medicines carry. And we've always had pain medicines. We've always had those medicines, but we had a different relationship with that medicine, and we had a different relationship with our medical providers, our medicine people who were giving us those medicines. So in many respects, when we're thinking about this in the context of opioid misuse or any substances, first there's the essence of the opioids and the medicines as a powerful spirit or prescription to be used. And second, the current perception of substance use disorders stigmatizes and produces shame or guilt. And in order for us to be able to help and heal and learn from the lessons that tricksters have to offer us, we need to address our relationships with those medicines rather than shift our understanding of these relationships. Next slide. So there's a whole lot, there's so much research that shows that there's a connection between trauma and a myriad of health outcomes. And particularly powerful is the process by which colonization has become internalized for American Indian people and serves to shape health outcomes. Genocide against Indigenous people in the Americas was one of the most massive and longest lasting campaigns in human history. And we can argue that is continuing today. And historical traumatic events have contributed to health disparities related to social and behavioral factors, such as resulting in increased headed outcome, significantly higher poverty rates, larger families, health outcomes like diabetes, immune deficiencies, drug and alcohol issues, as well as mental health issues. And there's been a lot of work by scholars up in the Pacific Northwest, doctors Karina Walters, Jane Simone, and Tessa Evan Campbell to really talk about how trauma connects to health outcomes. But what they're also talking about is how our culture buffers and acts as a protective factor, particularly our connection to our culture and our identity, enculturation, spiritual coping, traditional health practices. So the work that we're doing at the board right now is really thinking about those protective factors and really thinking about connectedness, connection to our ancestors, to our spirit world, to the land, to our community, as well as our culture. Next slide. But, you know, we talk about trauma too. In Western worlds, we really pathologize everything. They're kind of obsessed with pathologizing everything. And so part of it is for us is reframing these things and not pathologizing them. And so, you know, we know that there's a connection between trauma, early childhood trauma and substance misuse. But it's important to acknowledge that the word trauma comes from a Western medical context, and it doesn't really represent our experiences as tribal people thriving despite that trauma. And so when we're thinking about other terms, we like to frame, you know, trauma is a survival mechanism. It's our body's response to surviving extraordinary psychological experiences and threats to life and personal encounters to violence. So this isn't a burden that we carry, it's a strength. We learn these skills to survive, but what happens is in adulthood, those skills get twisted and are not really serving us anymore. And so we have to learn new skills to respond to traumatic events in our lives. Next slide. And as we know, there are kind of these, you know, survival responses that we create. And, you know, there's fight, flight, freeze, and fawn, which are the primary kind of ways that we are able to survive these psychological events and threats to violence. But we start developing kind of these, you know, these databases of information. And what we're also starting to understand is that these databases of information are also epigenetically transferred. Next slide. And so we do know that there's a connection between historical trauma and current health outcomes. And historical trauma results from the long-term effects of the oppressive, traumatizing policies, attitudes, and beliefs of the colonizer towards American Indian people. It includes the lack of resources and opportunities for us, the current treatment of American Indian people in this country. And Maria Braveheart Yellowhorse defines historical trauma as a cumulative emotional and psychological wounding over the lifespan and across generations emanating from massive group trauma. I also like Eduardo Duran's definition of historical trauma, and he refers to this as soul wounding. And these soul wounding symptoms of historical loss are interconnected, each one of them having varying degrees of impact on us. But there's a direct connection between colonization and the effects of historical trauma. And you know, the negative broad social factors that have influenced by colonization, such as racism, acculturation, poverty, are translated into everyday physical and emotional distress. And this trauma, like I shared, we are starting to understand can be epigenetically transferred from one generation to the next. Next slide. And so because there's some evidence that trauma is epigenetically transferred, it doesn't change our DNA. It changes the proteins that surround our DNA, which consequently change the uptake of information. But what we're starting to understand, and this is a picture of my grandfather, and his name was Little Joe Gomez. And he used to tell me that the memories of our ancestors are passed down on our blood. And that we are able to access those memories through ritual, ceremony, and practices of gratitude. But what I interpreted, what he's also talking about is that we not only inherit our historical trauma, we also inherit our ancestral memory and our ancestral knowledge. And that is also a resilience thing. We are stronger because of the ancestral wisdom and knowledge that we carry. Next slide. And so, you know, trauma, what we do know is that trauma is stored in the limbic system of the brain, which is that very old primitive part of our brain that's not connected to language or to memory. It's really, it's stored, because memory is stored in the cerebral cortex. So when we have a trauma response, literally we have our brain disconnects. And so part of trauma healing is to bring the limbic system back into health and communicating with the cerebral cortex. And we know to do that, what we know is to access ceremony, ritual, mindfulness, yoga, deep breathing, connection to land. All of these things help us to bring our limbic system back into health and communicating with the cerebral cortex. Next slide. So Dr. Gabor Mate talks a lot about the connection between trauma, but really connection and connection to each other, our community. And when we're disconnected, that is the predecessor for our substance misuse and dependency. But one of the things that he talks about is that substance dependence always originates in pain. The very same brain centers that interpret physical pain become activated during the experience of emotional rejection. So in our brain does not acknowledge any difference between physical, emotional, spiritual, and mental pain. So the question for people when we're talking with people who are suffering from chronic long-term dependence on substance, it's never about the addiction, it's always about the pain. We should be asking them about their pain. Next slide. But there's always hope. We know that trauma reactions may occur when there's substantial perceived or actual threat. However, we also know that people often experience the same event and react very differently. And so we also know that we are strong and resilient. For tribal people, we've been fighting against one of the largest military organizations in the world, and yet we are still here and we are thriving despite the attempts of genocide against our people. We are strong, we are resilient because we're connected to our ancestors, we're connected to our land, we're connected to our culture. Next slide. And so when we think about resilient responses to trauma, what we really need to think about is how people cope with and creating healthier ways to cope and respond to and heal from trauma. And often people automatically reevaluate their values and redefine what is important to them after the trauma. If they're receiving support from their community, we cannot heal from trauma independently. So when we go back to thinking about Maria Braveheart's definition of historical trauma, it's a trauma that happened to a group of people in a very specific place and time. So consequently, the healing of historical trauma happens collectively. And what we're starting to understand and research is, what does that actually mean? So we come back to our family, we come back to our community, we reassess our relationship with our ancestors and our spirits, and we reassess our place in the world. Next slide. So when we're thinking about the way that we can heal and process through trauma and using information about biology and trauma, what we understand is that we can support our clients through providing a message of hope. Hope is an incredibly powerful medicine. When people understand that they're not alone, they're not at fault, and that recovery is possible and should be anticipated, that can shift people's experiences with healing. trauma is something that happens to them. It's not who they are. So we need to reframe that. So one of the most powerful statements that I got through my trauma healing was that I'm having a normal response to an extraordinary event. Again, so sharing that you are having a normal response to an extraordinary event, it's not about who you are inherently. And reframing the experience of the events, understanding and sharing with clients or patients about, what is hyperarousal and why is that happening and why there are other physical symptoms that come off as psychological reactions to extreme stress. And communicate that treatment and other wellness and activities can both improve psychological and physiological symptoms. So ritual, ceremony, connection to culture, dancing, chanting or drumming, all of these things, these ancestral teachings that we have actually help us to regulate and heal from trauma. Next slide. So what we know is what works is when we have people who are trained in many different theories and models of work, people who are client-centered and counselor-driven, when we focus on strengths and protective factors, those who are able to develop trusting therapeutic relationships, and those who work within their area of expertise. And what we're understanding now is that culture is prevention, that when people are connected to their culture, when they're connected to their community, they're less likely to suffer from substance dependency. Next slide. So a lot of what does that mean in the world? Part of it is shifting the way that we understand health and wellness and moving from this pathology kind of focused way of looking at things to understanding that it's balance and wellness. And so health and wellness from a traditional Indigenous perspective is centered on holism, whereas Western perspectives are really based on illness and disease. And this includes philosophies that equally consider the spiritual, mental, emotional, and physical aspects. But it also includes our relationship to our ancestors, to our ancestral knowledge, to our spirits, our relatives. And it's also in relationship to the land and all of life on this planet. And so in this model, in this image, the individual is represented by this tree, and our ancestral knowledge and wisdom is represented by the sky, and our relationship to the land or Mother Earth is represented by the land. But surrounded around it is the representation of our community. We cannot survive colonization independently. Next slide. So when we think about community care in Indian country, what we need to think about is connection and belonging. And the more connected people are to belonging and to their community, the more connection there is. And so what we're really talking about in research, especially in Indigenous research, is cultural connection, ancestral connection, land and community connection. Creating sacred spaces, even if the sacred space is in a little altar in your apartment in the city, or if you have your ancestral lands, going out to your land, but creating a sacred space, a place where you can feel safe and grounded and centered is really important. I think in this society and in this world, we're suffering from an epidemic of loneliness. And loneliness and social isolation can be as damaging to health as smoking or misusing substances, especially among youth and elders. And because of the pandemic, this has been made worse. And although social media has helped us in some ways to create connections, it's also perpetuated disconnection in some ways, especially with like online bullying and things like that. We also know that our stories, and when we are able to find spaces where we can share our story, that this is also sacred. So some of the things that we're talking about at the board is really like thinking about that sacred trust, developing a sacred trust, and that our stories are sacred, and that we need to support people in creating a sacred space for telling their stories. And going back to our ancestral ways of knowing that prayer, mindfulness, contemplation, meditation, ritual, all of these things, they don't just help us regulate our trauma, it actually helps our brains to become more plastic, more flexible, and more resilient to ongoing trauma. So when we have a practice of prayer, of ritual, of mindfulness that we do every day, even if it's a small thing like burning some medicine and thanking our ancestors for supporting us in this life every day, that helps us to become more resilient. And to create, to sing, to dance, to draw, to cook, to do all of these things, that creative outlet also helps us to develop a more plastic and flexible brain for healing. Next slide. And again, when we're talking about, the use of medicines, whether they're prescription medicines or plant medicines, we need to reestablish our relationship to medicine, coming back to that Indigenous worldview of our relational worldview. So reestablishing our relationships with medicine, this includes our relationship to food, to water, to plant medicines, to land, to the air, but reestablishing that relationship, even if it's a prescribed relationship. When I was prescribed some opioids, I kind of almost went into treaty with that medicine and thanked it for offering me relief for the pain that I was in. But I also had a relationship with my doctor and talked with my doctor about my concerns about using opioids. I have an allergy to some opioids, so talking with them, so reestablishing and changing our relationship with our medical providers and medicine people, and developing a relationship with the spirit of the substances, and as well as like the treatment of it. And so what we know, next slide, is that, if trauma impacts the epigenetic transfer of trauma, culture and connection can mitigate these impacts. If we want to prevent substance misuse, we need to focus more on stress, trauma, and poverty while providing intervention options that are grounded in traditional Indigenous knowledge. We can heal our communities through culture connection and developing interventions and policies that are grounded in traditional Indigenous knowledge, tribal-based practices, and evidence-based practices. And this isn't just true for the case of substance misuse, but in other health conditions as well. So that's the end of my presentation. I want to just open it up for some conversation or questions, whatever might work. Thank you for listening. That was a lot of information really quick.
It was great. Thank you. Thank you, Danica. That was wonderful. Jace, if you would like to go first, you had posted kind of a question in the chat. So you want to go ahead?
Sure. Thank you. So I guess my question would be, I working with individuals with trauma and even doing my own trauma work, I guess my question would be like for our relatives that were not raised in traditional households, were raised off of the reservation, maybe raised with parents who have either been through boarding school so they don't practice anything, and or non-native families who don't practice any of our culture, they have no knowledge. I guess my question would be, how does the generational trauma get passed down, or how does that show up in their life? You know what I'm saying? I hope that makes sense.
Oh no, that totally makes sense. Okay. I am that person. I was born and raised in northern New Mexico on the Taos Pueblo Reservation. I grew up in a little village outside of Taos, but I'm Choctaw. And my whole life, like I grew up in the Native American church, like my father was a roadman. So I grew up in Native communities, but it wasn't my own culture, right? I had no idea what it meant to be Choctaw. I had no idea. So and I had a lot of, and that's why I used to talk to my grandfather. I would say, well, but I'm not Taos, I'm Choctaw. I don't know what that means. And he said, it's okay. The memories of your ancestors are passed down on your blood. You just need to learn how to listen. And, you know, when you're a child, I'm like, well, that just sounds crazy. I don't know, you know, but when you get older, what you realize is that, yeah, we need to learn how to listen. It's a memory that's passed down. And what I learned is that when we are able to really quiet ourselves and listen to our ancestors, those messages come. Now that's terrifying for those of us who have a history of trauma, right? Because we create all this noise so we can avoid that pain. But so I like to use the metaphor, you know, I love our Plains Indians because they have these, you know, these stories, you know, the buffalo walk through the storms. When they have these massive storms on the prairie, the buffalo will walk straight through it. So they're in the storm for less time. Domesticated cattle follow the storm. So they're just kind of walking with the storm. So they get stuck in the storm for longer. That's the same thing. We need to walk through the storm. And it's terrifying. It's terrifying. But that's what that's what has to happen. We have to find a place to tell our stories so then we can get silent and listen to our inheritance. These messages, these stories, these lessons that our ancestors put on our blood, that's our inheritance, right? But we have to learn how to be silent, to listen. And we do that through ceremony, through prayer, through ritual, through deep breathing, meditation, yoga, whatever you want to talk about it. We are able to access that knowledge through drumming, right? There's a reason why when we hear that drum, it resonates in our cells and it's resonating those messages. So, you know, that impact that colonization had, where it took us from our culture, right? That's part of colonization. The antidote to that is to go back but that's a hard lesson because many of our communities, they're also traumatized, and there's this lateral oppression that happens. It's like, well, you're one of those city Indians, or you're one of those Indians, or you're a light-skinned Indian, or you're this, right? That's colonization too. So we have to create spaces for those people who have been disconnected from their community to be able to come back. And if they can't come back, to create spaces in their communities where they can feel connected to their ancestors, to their land, to their culture. Some of our cultures have been so harmed by colonization that we don't even have our creation stories anymore. But again, it's on our blood. We just need to listen. But again, it's terrifying to listen, to be silent. So we have a lot to do. But if we can create those spaces for our clients to feel safe enough to be silent, then we can help them through that process and connecting them. So a part of my healing journey was in my 40s, and I went to go get my PhD. Part of my dissertation work was to go work with my tribe. I worked with Choctaw scholars, and we developed an intervention. We were working with our tribe, and we re-walked the Trail of Tears. And I interviewed women about their experiences of healing historical trauma through that experience. I learned at that point what it meant for me to be Choctaw and reconnected to my culture and reconnected to my ancestors. So when we go back to what Maria Braveheart was talking about, is that healing of historical trauma happens in community on the land. that the harm was caused. Again, terrifying. I was a hot, excuse my language, I was a hot mess. I was so pitiful the first time I walked the Trail of Tears. I was terrified, but I just kept praying and, you know, just wanting to set the intention to be a good ancestor and learn what I could. And I was able to walk the trail 5 times. And every time I walked the trail, I had a transformative experience because I was walking the trail with Choctaw women, with our ancestors in the place that our ancestors were harmed, and we transformed that healing. And when we heal in this life, when we do the healing, we heal past harms and we heal future. That's powerful, right? And so Karina Walters, when we were walking the trail, she always said, don't get stuck in the drama of the trauma, because it's easy to get stuck in the drama of trauma. So what we would talk about is like, we need to create a vision of health for the future generations. So that was like our mantra. What's our vision of health for future generations? Because our healing in this place and this time, it impacts, it's like time travel. You're healing your past ancestors and you're healing the future ancestors. And it's a beautiful thing, but it's a huge responsibility. So that's a long-winded answer to your question. It's a hard question. We could spend a whole hour just answering that question because there's so many layers to it. But we know that healing can happen. Historical traumatic healing can happen. I've experienced it.
I think that, you know, just listening to this, I've written down all kinds of other full sessions we could do, right? I mean, we could talk for the rest of the day, I bet, and go off on all kinds of great topics. Does anybody else have a question? You're welcome to raise your hand or put it in the chat. Oh, Kathy, yeah, do you want to go ahead?
I do. So I am not Native American. My patient population is largely Native American. And I have 2 patients in particular that struggle with these trickster spirits. Mm-hmm. And I struggle with how to help them. I listen to you, and this is very fascinating, and it's very helpful for me. And I know that I can work with them on finding a place that they can be quiet and to try to allow those spirits to work through them. And so some of the things that I've learned today can be helpful for that. In both cases, they don't want these spirits.
Nope.
Is that always the case?
I mean, so there's a couple things. One, I'll give you a resource. I would read Eduardo Duran's book called Healing the Soul Wound, because he talks specifically about this. But Theta Newbreast one time, I'm totally pinching this idea from her, is she talks about, and Eduardo Duran talks about this too. In some ways, we don't have control over like some of these spirits, right? And so you have to go into treaty with them. Theta talks about going into treaty with it. And Eduardo Duran talks about it too. Now, some of these spirits are very, very dangerous. Like the spirit of alcohol is a very dangerous spirit. So you don't want to just tell a client, go into treaty with this spirit and be independent. But so they talk about going into a treaty with it, and it's terrifying, right? Because these spirits are dark spirits. And to sit down and look at it, offer it some tobacco and say, we need to come to a resolution. We need to negotiate our relationship because this isn't working for me anymore, right? So part of it is kind of role playing that with them, but it gives them some control over that relationship, which, right? And when we think about addiction, it's really like dependency on a substance is when we don't have control over that relationship anymore. the drug has control. It controls our brain, it controls our emotions, it controls our behavior. So creating a role play where we can go into treaty with that spirit is a way to navigate that. But Eduardo Duran talks a lot about like what that looks like in his work in that book. There's another one by Renee Linklater called Decolonizing Trauma Care, where she talks a lot about these kinds of concepts and what we can do. But this is life and death work. So we don't want to go into it just willy-nilly. We need to really be thoughtful and intentional of like, okay, we want to talk about how we can negotiate with these spirits and sit down and you know, give tobacco. And so for me, it's like, I would suggest if there's an elder or a medicine person, traditional medicine person in your community, to talk to them about what that could look like. So for us, we have an Elders and Knowledge Keepers Echo, and I'll put it in the chat. It's specific to the Northwest. So, you know, we have 3 primary cultural groups up here. And so we have a representative from each of those cultural groups, but that's what we really talk about is we do case presentations, and we have these elders that can advise on these cases on how to best navigate it. And are there medicinals in the area that we can use to help alleviate some of that that struggle, that suffering? But so I would do that kind of work in collaboration with an elder or knowledge keeper in your area. I heard that Renee is like, when she introduced herself and said that she's an elder in residence, I was like, oh my God, you have an elder in residence? That's amazing. Like, so consult with that elder and talk to them about like, okay, what can we do to support our clients or patients in navigating and going into treaty with some of these spirits. And also, you know, your clients, in my practice, in my cultural practice, like we also have what we call Klingons, which are spirits that can grab onto us. So you have to brush them off and smudge all the time, especially when we're navigating these multiple worlds. So I have a daily practice of smudging with cedar, and because in my tradition, that's the cleansing smudge. And so I smudge and I make sure that I get rid of all those Klingons. It's the same. You can ask, you know, have your clients do that too, right? Developing a practice of smudging and cleansing, whether it's with water or rose water, whatever your tradition is. We have all of those medicines. We just need to reestablish our relationship to those medicines.
Thank you.
Yes, here at NACC, we are very fortunate to have elders in residence. It's I just feel so lucky. We have some wonderful folks with us. And Renee, it looks like she hopped off. We have Renee, we have Donna. I think we're looking for more. So yeah, it's a very important thing. You know, it's very helpful for staff and for patients and clients. So
I mean, this is very hard, deep, challenging work. And as practitioners, we also have to be really grounded in our own healing and our own, our own work. Any other questions?
Yeah, we have about 5 minutes left. If anybody has anything else. I don't see. One thing that came to mind for me, Danica, if you wouldn't mind. So for folks who, like Kathy, serve a patient population that is Native American, but it's not a Native clinic or program, so to speak. What could she do, to help that connection to culture, or so, you know, how would she find in her area, or kind of start that process of
yeah. Are all of you in Minneapolis?
No.
Oh, okay. Yeah, I mean, I think one is starting with like a small practice and communicating with your client or patient about, you know, what is their culture, where they come from. For me, like in my work, when I was working with urban natives, with youth, I would have them, I would start by having them research their creation story. And you can just Google, you know, Potawatomi creation stories. And so all of our ancestral knowledge is passed down through our creation stories. So that's where I like to start. And that's an easy way to just start a conversation with someone. Doesn't matter what their age is. Some of these creation stories are extinct, and that's an issue we need to talk about. Okay, well then let's create your own creation story. Let's tell your creation story. But that's where I start, is like, you know, giving them homework. I want you to research your creation story and come back. Because in our creation stories, you know, you can think about the Bible as a creation story. It tells us about who we are as a people, what we value, what our morals are, all of these things, the way that we're supposed to navigate the world as a human being. You know, the Iroquois Confederacy, they have a creation story. It takes 4 days to tell that story. You know, Anishinaabe too, you all have your creation story that's beautiful, and it's like tells you everything you need to know about who you are supposed to be. And so pulling in that, and that's the way that I start talking about that. And then practicing with them around developing a ritual, a daily ritual, whatever it is. You get up in the morning and you go out and you smudge yourself with the sun, like whatever it is, you know, but work with them based on their culture or their understanding of their culture to create little pockets of wellness, of grace, of gratitude. The other, a powerful healing tool is gratitude. It's why we give our spirit plates. You know, that's why we put tobacco down for the spirits in the trees and our ancestors. So helping them create a practice of gratitude can also be a way to do that, to start. So it doesn't feel overwhelming. You don't want to tell someone, oh, we're going to go walk the Trail of Tears. Good luck. No, right? That's way too much. But start with a little thing. Start with that creation story. Start with that ritual of gratitude. Start with that smudging, whatever it is, right? Whether it's water, rose water, whatever it is. Start small.
That's wonderful. I hope you don't mind, but I'm going to borrow Pockets of Wellness. And I'm going to absolutely use that. So thank you.
Right.
So it looks like we are out of time. Does anybody have anything they want to ask or mention before we say goodbye?
And if you are shy, or you just want to, or something comes up later, I'm going to put my email address. You feel free to send me an email and I will always respond.
And if you don't catch the email address, you are always welcome to reach out to us, and then we can make the connection. So Lindsay, when are we back in 2 weeks?
Back in, let's see, February 1st. And also I just want to let everyone know, I put the survey link for today's session. So we'd love your feedback if you would. But yeah, so the next session is with Melanie Nadeau. It's on centering culture in the treatment of OUD disorder. And that's February 1st. So thank you everybody for coming. We hope to see you next session. Thank you, Danica.
Danica, thank you for your time.
This was really great.